take you back to our top story tonight, the Health Minister briefing members of the Health Portfolio Committee in Parliament during a Zoom meeting earlier today. I want to speak now to the committee's chairperson, Dr. Sibongiseni Dhlomo, who joins us via Skype from KZN. Doctor, very good evening to you. Great to have you on. So, one of the main things that were flagged by the minister during that briefing this morning was around new clusters emerging. He made an example of 2 ShopRite stores in the Western Cape in particular being areas of concern. As a medical professional yourself, how do you imagine, how easy or difficult might it be to deal with that going forward?
Tembekile, I did not hear what you were saying about the Western Cape scenario.
I was making the example about the minister speaking, sir, about the cluster infections and how he used the example of the 2 ShopRite stores in the Western Cape. And I wanted to ask you then how difficult that might be to manage, because these are essential service areas where people are bound to come into contact.
Yes, we did receive a report, thank you very much, from the minister. We were a joint committee together with the MCOP Select Committee on Health and Social Services. The matter of the Western Cape area, especially in the farm area, was actually raised, and I am still talking to 2 other portfolio committee members right now because it was a matter of concern. We would want to contain the main issue that the country has done is to actually not wait for people to get sick, but go out there and look and actually screen and quarantine those you find. But if then there is sort of an abnormality where there is actually a reluctance to actually move away those staff members and actually quarantine those that might have been affected, we will have a challenge with that. We are working on that with other portfolio committee members when they alerted us to this matter also during the meeting this morning.
And I realize, Dr. Dhlomo, that the line between you and myself is not the clearest, but I want us to just persevere a while longer and talk about issues around the deployment or the arrival of the Cuban doctors, 200 plus of them arriving late on Sunday. It's been widely welcomed, but tonight the nursing union DENOSA saying that is wrong. In fact, what government should have done is prioritize thousands of doctors and other healthcare workers who are sitting without work. How do you respond?
The group of Cubans who have come in are largely specialists. There is no country in the world that has got medical expertise like Cuba in terms of public health. We are dealing with this pandemic that will need specialists like epidemiologists, virologists, at a high level of immunologists and all those specialists that have come in here. They are not coming in to actually replace any other person. They are coming in to add, as they are internationalists adding value to all other countries. So, look, the matter is not like we are replacing any other person. They are adding on their specialist knowledge, because you can travel the whole world. You will not find any group of medical expertise that you could compare with Cuba.
Let's talk about the lockdown itself, sir, because Minister Mkhize today again said that while from the 1st of May we're going to go down a notch to level 4 of the lockdown, should there be a rise in infections, we will go back to the tightest form of lockdown. Stage 5 is what we're calling it now, level 5. Do you think that the move to level 4 was premature, especially given the confusion about just how tight restrictions would or would not be?
Look, the situation changes almost every hour, or every day. But what we could commend on Tembekile for us as a country is that, which we actually commend the minister and the government for, is that unlike what has happened in other countries, you wait for people to get ill or cough and then sneeze, there is a massive screening out there, and that is actually among other things an add-on for us to pick up people much earlier than you would have done if we were to wait them to come to the clinics and hospitals. That the rising of numbers as we screen is not a big challenge, because we are actually able to contain and make sure that whoever was screened yesterday and then taken away for quarantine is not freely moving around to actually spread the virus to some of the other people who might actually be well affected by the illness. So we are actually wanting to say, Dr. Mkhize, you have done well in terms of starting at a very low scale with screening at about 100 to 3,000 and just 2 days ago was able to screen about 8,000 in a day. Please, can you improve on that so that at a particular time you could say in the country we have screened relatively well those hotspots, those areas we have wanted, and we now know that we can contain and lock down and move people to a dead end, those that we think have got some signs of COVID-19.
Finally then, Dr. Dhlomo, I'm keen to get your view on the lifting of the ban on cigarette sales, which also takes effect on the 1st of May. I know in the past few days you've been quoted speaking against a possible lifting of the ban on alcohol sales. What do you feel about cigarettes, especially given the possible health implications when dealing with a respiratory disease?
Look, as a medical doctor, you know I would never have a point. I would not recall any good point I can have about cigarettes. But however, I would not actually want to get into that because I would probably not have been privy to the decision that arrived at that. But if you can, at any given time, whenever I ran short of what is the cause of that disease, that illness at medical school, tobacco was always number one. If you forget and you take tobacco as one of the issues. So there's nothing really significantly medically good about tobacco, but I do not want to dwell into that now because it's one of those things that are coming in. Maybe the addiction, support to those who still want to. I would really want to get into that space very much, but I don't remember any good input that I can really take off on cigarettes.
Okay, Dr. Sibongiseni Dhlomo, chairperson of Parliament's Committee on Health, thank you so much.